Hello, my name is Thokozani Hanjahanja-Phiri. I am here representing the Ubiquitous Health Technology Lab in Canada. I work as a postdoctoral research fellow in the School of Public Health Sciences at the University of Waterloo. And on this presentation, I have co-authors, and they are Jasleen, Kaur, Arlene, Oetomo, and the director of the lab, Professor Morita. The title of this presentation is Assessing Health Equity in the Internet of Things Era, a study on algorithmic bias in public health outcomes. This is a proposed study. Okay, as a way of introducing everything, um, consider that indoor temperatures or the thermal environment affect sleep quality, and in turn, sleep quality affects physical and mental health. I'm highlighting a study that looked at the effects of thermal environment on sleep and circadian rhythm by um, Okamoto, Mizuno, and Mizuno. So here, they're saying that the thermal environment is one of the most important factors that can affect human sleep. And it is strongly linked to thermal regulation, which affects the mechanism regulating sleep. So at the UB Lab, we are concerned with digital health research. So when we see or have access to big data, we get excited. And why is big data um, a, a viable um, source of rich data? Well, there are three characteristics. They're called the V's, the three V's: high variety, high volume, and high velocity. And then we can expect efficiency in the data collection process because it's in real time, it's non-intrusive, and it's immediate. And then big data usages can be seen in different fields, including artificial intelligence, data mining, machine learning, generative AI, large language models, precision medicine, and predictive analysis. We are interested in data mining and machine learning in this proposed study. And so smart thermostats as Internet of Things connected devices can provide us with this data. The objective of this study is to evaluate and measure the impact of thermostat Internet of Things on health equity by capturing the prevalence of false positive versus false negatives in the algorithms created for the data extraction of Donate Your Data initiative from Ecobee, a smart thermostat company. So this work is not completely new for our lab. We do have published articles. So for this one, we have smart thermostats provide sleep insights at home. And this study provides a new framework for an objective, non-invasive, and zero-effort sleep monitoring system that utilizes smart thermostats equipped with motion sensors. And this work was done by Kaur and colleagues. And what they did is they developed this new pipeline. It's a data pipeline framework, which has been linked to Google BigQuery, which helps extract the raw data to an Azure storage, Microsoft platform, and then that there's pre-processing and process data that occurs and is transferred or utilizes Azure Databricks, and then that is stored on a local system. For our study design, we would like to collect several variables, and we have done this similar things in other studies with these variables, which include sleep time, wake up time, sleep duration, time spent at home, time away from home. And these are aggregated in 5-minute intervals. It can be up to 30 minutes, but we are interested in the 5-minute intervals. The study design adheres to PICO, which is P for population, would be households with thermostats. E for exposure would be Ecobee smart thermostats regulating and modifying indoor temperature. C for comparison would be non-smart thermostats. And O for outcome would be sleep quality. Then we apply the study design a checklist to it. We apply a checklist of FINA, which is feasibility. Is it interesting? Is it novel, ethical, relevant? And yes to all of them, because feasibility is possible because it's cost effective, uses secondary data. It's interesting because it's big data and digital health. It's novel because it uses a new data pipeline framework. It's ethical because of ethical approval that's um, obtained from the ethical research board or review board. And then the data is anonymized and it's secondary data. It's relevant because we're still in the pre and post COVID era. Some of the confounding variables are housing characteristics such as floor area, number of occupants, number of floors, age of home. And then for the demographic variables, we'll be interested in the state and city. We're limited to those two because other information is not available. The source of the indoor temperature data for the exposure group would be the donate your data. It's very good because it's pre-consented, it's anonymized. You can have it for long periods, up to 5 years. Right now, where this one it says up to 2023, but you even have data for 2024 available. And there's granularity in that you can collect the data every 5 minutes. The number of households exceeds 17,000, almost reaching 18,000. And then for the other variables, we can get household information on geolocation, size, floors, age, remote sensors, and number of occupants from the metadata. And the thermostat data is a time series type of data, IoT data, which includes indoor temperature, humidity, and occupancy. For the comparison group, we would get the information from daily meteorological reports for indoor temperatures for the area. Now, for social demographic factors, we would not find those on the DYD data, but the US Census data, for example, if we use New Mexico as a state and then the cities in that state could provide us with social demographic factors such as population, the income levels, the median income levels, education, access to health coverage, race and ethnicity, housing, family and living arrangements, employment levels, and other variables. And so to our findings. So there are expected findings and unexpected findings in that we would want our study to be solid, but we can anticipate to find disparities based on the sample population in this kind of study, in that there might be sample bias because of the overrepresentation of certain demographic groups. There might be selection bias because it could be sensors are not installed in every household. There might be disparities based on machine learning models. Systematic errors can arise due to biased training data and flawed assumptions. Some methodological limitations highlighted in the literature are like big data and discrimination. These often go hand in hand, unfortunately. And then there can also be limits of privacy in the automation process and data mining, in that it's not within the control of the researcher to control what's happening with the algorithms. And technical challenges are related to the devices, in that there has to be energy optimization, device incompatibility might arise, security and privacy and data connectivity might be some issues of concern. And so, what are the implications for evidence-based public health? Well, we want equitable outcomes. That is like the ideal, that is the goal. But if there's bias and inequity in the extraction and utilization of IoT data, then this can contribute to more inequitable public health strategies and policies. And then you want your policymakers to be informed, but they could be misinformed due to this, the lack of accounting and accountability of these algorithms, because they're autonomous. And so the proposed study findings can help authorities to mitigate potential unintended effects. Policymakers can make better informed decisions when they have these issues in mind when using big data and findings based on digital research um, or digital health research. So we're at the end of the presentation, and I'd like to thank the director of UV Lab, Dr. Plinio and Morita, the data scientists who helped with this presentation, and Navneet Kaur, our funding partners, Ecobee, CHR, and CERC. The research credits received from Microsoft Azure. And then this research has been partially supported by the Natural Sciences and Engineering Research Council of Canada and Ontario Centre of Innovation. I'm happy to connect with anybody who has further who has questions and would like clarification. Otherwise, see you at the conference, and all the best. Thank you for listening to this presentation.